So I'm going to take you inside in a second to show you how we do a platelet-rich plasma procedure. It's mostly right now for pain management. We use patient's own platelets. We draw it from the blood, we spin it, and we're going to show you the entire procedure. And we've done multiple procedures with PRP for pain management, especially for knees, shoulders, any area, elbow, tennis elbow, and other areas with pain. And it's very, very effective in restoring some function and also improving basically much better pain management. We have actually used much less of steroid injections lately because of the PRP. It's very, very effective, and it can last over 12 months with one injection. And if you do multiple injections, you can have it last longer. It's not just pain management, but it also restores function because it's your own platelets, and it regenerates some of the tissue. So we go inside right now, and we are going to be showing you the actual procedure in a second, once we get everything ready and going from the get-go. Okay.
All right, poke here. Did you feel it?
Mm-hmm.
Doing okay?
Mm-hmm.
Okay. All right, so right now we just drew 60 milliliters of the patient's blood, which we're now putting in a concentrating device so that we can spin the blood in our centrifuge and separate the white blood cells and red blood cells from the platelets and plasma. Then we'll do a second spin that will highly concentrate the platelet-rich plasma for injectable into both the patient's knees.
So this is the centrifuge where we would be putting the what we drew, the blood what we drew, and I just spin. This is where we put it. This is the counterbalance, and it spins. I'll show you in a second, and it separates the platelets from the red blood cells. And Heather now is injecting the anticoagulant so the blood doesn't clog. She's weighing the amount of blood so the counterbalance has the same amount.
So the reason why we want to separate the red blood cells and the white from the plasma is because the white blood cells are inflammatory and we want to reduce inflammation.
So I'll take that. Just bring the blood here because you have gloves on. So this is where we talked about the counterbalance, right opposite, and this is where it's going to start spinning and separating. We'll show you the process in a second. So right here is when we set the time. So it's on 3 minutes.
So we want it on pure PRP, spin 1.
Pure BMC, pure PRP spin 1. That's 2 minutes. And then we're ready to start. So as you can see right now, it's starting to spin, but it's gonna go extremely fast. This is one of the best centrifuges out in the market. It's actually made to separate really the platelets from the blood with very high concentration. It can concentrate up to 13 times depending on the volume that you take and how many spins and how we set up. So right now it's going really, really fast. So closer here. And that's what makes it really one of the best centrifuges out there, because you can concentrate the platelets really, really good compared to the concentration inside the part. So we'll get back with you guys in approximately a minute or two once the blood is separated. Don't want to keep you here, but we'll see you in a minute. Welcome back. So I just want to be clear that the PRP we're using today is not for cosmetics. It's for actual medical procedure for management of osteoarthritis of the knee. And then so if you want, well, let's show first prep the knees. We're injecting both knees today. Heather is getting ready to prep the knees sterilely so we can do the injection. Go back here. So now that we have this, the first step is done because we're going to do 2 spins. If we do 1 spin, this is what we're getting. As you can see, there is already some separation. The red blood cells is at the bottom right here, and the plasma is on top. What we're going to do is we're going to get rid of the blood cells And then we're gonna keep the plasma and spin it a second time.
We lived together for 9 years.
Have you?
Yeah.
Because when you said it was your house in Florida,
It was a rental, but we got the house.
and it is the
Can
house
you
in
hear?
Florida. Gotcha.
You'll see what I'm aspirating here is
Yeah.
actually
Yeah.
aspirating the plasma. And it's all done
Like a sweetheart.
in a closed system, so it's all sterile. Obviously, we want to inject this into the knee, so it has to be completely sterile. And then once we get to the blood part, you'll see the blood start coming up into the tube right here. Give it 1 second. Just get the air empty from here. So we can aspirate a little more. And this is a large volume that we're doing around 60 cc's of blood, and we end up with around 30 to 35 cc's of, and this is what we got right here. So now that we have this, we're gonna put it into the second tube. Yeah, so we'll do that. And again, the second spin will concentrate the plasma a lot more. See what I'm injecting?
So it's 7 times concentration of whole blood.
Yeah. Again, we're gonna weigh this. Okay. So now that we have these, we will spin again. So with this one, we go to spin 2. It's 6 minutes.
Okay.
Now we're just gonna start again. It's gonna spin, and it will give us even higher concentration. I will show you in a second. In the meantime, here, if you wanted to kind of show the sterile field, this is where Heather would be actually accessing the knees with a very tiny needle that goes into the joint space. That's where we will be injecting the PRP. The PRP, again, I was just trying to explain. It's a rejuvenation and a regeneration of the tissue. That's what it does. It's a healing substance that brings all the stem cells. It attracts the stem cells into the knee, and the stem cells actually do the healing. Anything on the inside of the knee, ligaments, tendons, cartilage, meniscus, all that can heal much better with the PRP. And we'll get back with you in a second when we get the second spin.
All right, so we've just finished our 6-minute or our second spin. So we're gonna take off the platelet poor plasma so that we have only the platelet-rich plasma for injection into the knee joint. Once we do a second spin to highly concentrate, you form a buffy coat at the bottom of the concentrating device. And so what's left here is plasma that's poor of platelets, and the platelets buffy coat have been spun right to the bottom there. So we'll take off the excess plasma that we don't need. And then we resuspend that buffy coat of platelets. Awesome. Okay, so Mary will wipe that, and then I'll draw it out sterilely with these. Okay, one knee. This should be the other. So we're going to inject into the medial portion, into the joint space. So you might feel a little pressure, but you shouldn't feel any pain. How you doing?
I'm doing good.
Awesome. Good job. Okay, right knee's done. I'm going to come around. We'll inject left knee. So after we inject the platelets, we tell patients not to take any anti-inflammatories. We want the inflammatory response so that these platelets release those growth factors and help reduce her inflammation and pain. So temporarily, sometimes patients have a small window of increased pain and symptoms because they can't take their normal anti-inflammatories. But eventually, sometimes, a few weeks, actually we've had some patients within days felt better. So almost all of our patients have reported significant pain reduction from their osteoarthritis in the knee joint. Occasionally it'll take a second injection of platelet-rich plasma to continue that healing process, and or moving on to stem cell injections to help rebuild the knee joint. All right, how do you feel?
Fine.
Good? Good job. We'll just put some Band-Aids on and we're good to go. Thanks for watching our platelet-rich plasma injection into the knees.